regardless, right?
Recording in progress. For those of you that are just joining the webinar, we're going to get started in 1 or 2 minutes. Thank you for signing on time. Welcome to our webinar. We are the physicians of Carnegie Women's Health. Carnegie Women's Health started in 2019 as a women's health branch of Maternal Fetal Medicine Associates. It's staffed by Doctors Aaron Gottlieb, Stephanie Lamb, and myself. We practice care for women of all ages. In addition to gynecologic care, we perform cancer genetic screening, bioidentical hormone therapy, and as 2 aesthetic procedures. And the purpose of today's webinar is to discuss our aesthetics program. We're going to begin with Dr. Aaron Gottlieb, who's going to describe the first of these, which is called truSculpt ID.
Hello. I'm so excited to be able to have the opportunity to talk to you about truSculpt ID and body contouring. So over the last number of years, the BMI in this country has been increasing steadily. And we often feel, or at least, it's portrayed as a negative thing. And I think what we need to do is be healthy, be aware of our bodies, and feel really good about ourselves. And so one of the things that body sculpting and contouring can do is really make you feel a little bit better about you if you are feeling that there's an area of concern. And so that's why it's been becoming more popular. And what we can do is personalize some non-invasive procedures to assist in anything that's bothering you. Mike, if you could switch the slide, please. So how truSculpt ID works is by using a revolutionary monopolar radio frequency technique that will actually penetrate from right under the skin layer, the fat cells, all the way down to the muscle. And it has been shown clinically to reduce permanently the fat cells up to 24% per treatment. If you can turn the slide. So listen, you're not going to turn into a size 2 if you're a size 10. Genetically, you are what you are, but a lot of us have areas that we may feel we want to improve on. And so to talk about how truSculpt ID pre-treatment, and I don't know if you can see this slide. I can't see it on mine. Okay. So what we do is you will come in, you will meet with one of us. I think it's really important to kind of go over what your goals are in terms of body contouring. And I think by meeting one of our team, and our team in terms of offering you the treatment is going to be the physician team. And we will talk to you and see what areas are of your concerns. And then we will mark those areas and talk about the goals of which you'd like to treat. And then we will create the area, and then we will use these hand pieces. They look like little squares, and we put them on the areas of targeted fat pockets. And it's easy to put on. They're very comfortable. We can turn the next slide and we can actually see what they look like, I believe. So you can see these little squares. We put them on. You'll get a sense of this warm feeling. It feels like a hot stone massage. The treatments last for 15 minutes. And then what we do is we see the results over 12 weeks. You'll come into the office. We will take pre and post pictures. And then if there's another area, we can always personalize to another area. Sometimes people will require a second treatment for optimal results.
Erin, I just want to if you can go back 1 second, Michael, just to interject for 1 second. I think when we look at the technology, which we'll talk about, and we use heat specifically, and the heat comes through each one of those pads in size are probably somewhere around 4 to 5 centimeters, would you say, in size? So you get a lot of area covered within one pad itself. And then the area around that pad, about 1 centimeter around each side, there's still heat that's distributed to that area. So you're getting a decrease in fat even below and around where that pocket is, that 4 centimeter pad. And so when you come to the doctor and we see what your problem areas are, we can move each of these little squares in different directions. They don't have to all be in a line. They can go up and down. There's different ways to tailor it, but it even goes a little bit around. So you get a lot of area just from one little square itself. It's pretty incredible.
That's a very important part. And another thing to notice is that it will then look smooth. It won't look like you will just have these loss of fat just in those squares. You won't be able to tell that you've had a treatment done where you'll have some puckering or pocketing, which some other body contouring non-invasive techniques, you can actually see those results.
Mm-hmm.
One of the beauties of this non-invasive treatment is that there is really no downtime. So people can pop off the table 15 minutes later and go back to work, to the gym, pick up your kids, go on vacation, go out to dinner, whatever you want to do. It's really nothing. The most adverse side effect, if you could say that, is really that your skin may be a little bit tender or a little bit red just from having the heat on. So I know everybody wants to see these results, and I think you have to remember what you're starting at. So this is a baseline of an arm. We can put them under your arm here. And then this is after one procedure, which would be around 12 weeks. You can see the loss of fat cells. The other thing that's important to know with truSculpt ID is that not only does it permanently destroy those fat cells, but it also creates a tightening of the skin. So that makes it, you're not going to have this flabby skin that's hanging out if you've lost those fat cells. So that's very nice. Here we have the ability to do underneath the chin, and which is we have a hand paddle for that. And after one procedure, you've gotten definitely a tightening and a loss of fat. And here's after the second procedure. And I think that this is a great result for this patient. Okay, so we always talk about, the post-baby belly. And here we have a woman who has a little bit of what we call a pannus, where the fat hangs over. In the next slide, next image, you'll be able to see that it's not hanging over, and there's a tightening that has occurred as well. And I think that that's a really beautiful result. And again, this also, you can see that not only did it decrease the fat, but it also tightened up the skin. And I think that, and you know, this was marketed to our CWH patients as a mommy makeover. And I think this is probably a really good post-pregnancy belly, and the beautiful effects of using this treatment. And again, here, tightening and decreasing the fat.
And just to interrupt again, Erin, I think, you know, this webinar that we're doing, and we labeled it as a mommy makeover. This is really geared towards any woman, and even male, the partners, male patients, who are just interested in doing something to really just improve isolated little things that they can do to their body, that maybe going to the gym and working out isn't necessarily working for them and their trouble spots. This is not necessarily like, just like you said, you get on the scale and you're going to notice a 10-pound weight loss. No, you still have to take ownership for eating well, drinking lots of water, exercising. We do have you weigh in beforehand. But whether you just had a baby or whether you're 10 years after your baby, this kind of appeals to everybody. This is just a good way for you to continue to feel good about yourself.
And one of the most remarkable results is it's not necessarily as visual as you'll see by the Secret RF, but clothes fit dramatically better. The vast majority of patients that undergo this talk about clothes fitting looser, belt loops being a little bit tighter. And so even though it's not as aesthetically gratifying, it's very measurable from the individual's perspective.
So people describe it as wearing a pair of Spanx without having to feel like they're wearing a tight girdle. They just feel a smoothness in their clothing. And I think it's really important to remember that people are doing this for themselves as an individual. The ideal person to do this is someone who is, you know, exercising, eating well, taking care of themselves, and has these trouble spots. And you can see in this picture right here with the flanks, it just smooths out the area. And this is after 12 weeks. And I think those are the spots that tend to be very difficult to achieve, even with all of the diet and exercise that people do. And we just want people to feel good about themselves and feel healthy. Again, here's another arm, and I think this is a great response. Here's another view of a neck. So now we're going to let Stephanie talk about, we're going to switch positions to body contouring and talk about the Secret RF, which is really used for so many wonderful things. So take it away, Steph.
So I think when we started doing this and looking at our patients and what really they were looking for when they came to Carnegie Women's, besides looking good from a physical perspective, when we look at weight and fat distribution, the number one thing that people do when they look in the mirror is they're looking at their face and they notice line changes, photo damage. They notice if they've had surgery, C-section scars or scars from any type of surgery, dark spots, or even creping of the skin and some stretch marks. And so this is really what started happening over the last 4 or 5 years. Patients would come in and they'd be like, oh, how do I get rid of this? Well, the technology has evolved, and there's this product on the market called the Secret RF. And essentially it's innovative. It's an aesthetic procedure that basically has no downtime essentially, and it's offered in the office. And the procedure itself takes about 15 to 25 minutes to do, with a little bit of time ahead of time to come on in and meet with us and get prepped. Go ahead, Michael. So in general, what is Secret RF? It's a technology that uses microneedling. And essentially what happens is a microneedle are a bunch of little needles. And in this particular product, they come in a cartridge. So there's a handheld device that we use and it has a little cartridge at the tip. There's about anywhere between 25 to 64 needles, depending upon which one we use for which patient. And we try to tailor it to the particular patient's skin type and what we're doing. And that cartridge basically touches the skin, and then there's a slow release of these needles. So it penetrates, it makes contact to the skin, it penetrates the skin itself, And what's beautiful about the machine is the way that it penetrates and it's nice and slow, you really get way less pain than with previous products that were on the market. It takes advantage of bipolar radio frequency. And so what it does is it basically denatures the tissue around it, and therefore it affects the surrounding tissue beautifully. Why do we do microneedling? We're trying to rebuild up collagen and elastin, and we're going from the base down, and we're trying to rebuild and regenerate and basically start fresh. So these needles puncture the skin, and then we build from the bottom down. What makes Secret RF unique? Well, any type of microneedling, when we puncture, it really depends upon how deep we're puncturing the skin to what we're trying to achieve. And you can go from very superficial, a 0.5 millimeter, which is almost nothing, to 1 millimeter. And we can go down as deep as 3.5 millimeters, depending upon what we're trying to achieve. So for things like the forehead or the hands, we go superficial, and things like stretch marks, we're going deeper. And when you look at the picture on the top right, that is how the cartridge looks and how it basically shoots off those little needles. The same cartridge is used for the same time, and it's one per person. Once we use it, it's discarded. The technology enhances the patient comfort because it's slow, it's steady, and it's smooth. And the technology itself basically reduces the damage that we worry about to the skin and the epidermis itself. And once again, as somebody who's actually done it to myself and knows plenty of friends who have done it, the technology is amazing, and it's improved safety. Why the Secret RF? Well, the technology itself, when you look at other machines or competitors, or even the handheld microneedling, they use gold plating. And you say, well, why does gold matter? It's an antioxidant property that improves the conductivity or the bipolar that goes through. It protects and ensures that you don't get that extra damage to the skin with excessive heat, because obviously we're using heat to come through. And it doesn't wear down. So no matter how many procedures that we do, it's going to stay fresh. And no matter how many times that needle is basically released, and you can do up to about 1,500 little injections throughout the face, the back, the hip, whatever you're doing, it does not wear down due to that gold technology. Pre-treatment. So essentially, for patients who are interested, we typically try to meet with the patient ahead of time. We could do a consultation. There are times that we do same procedure and consult on the same day. We look at the patient on their face, or if it's on a scar, we basically remove any visible hair. So we'll remove the hair in that local area. Do you have to shave eyebrows? No, we can actually adjust and lift and move eyebrows in that area. And you can actually do treatment to try to maximize this area and this area here. We basically have the patient wash their face with some soap and water. They come into the office, and then we apply a topical anesthetic prior to the treatment. And the reason why this topical anesthetic works, it basically just numbs the treatment area, so that way you get less pain. Even though the machine itself is so wonderful for decreasing pain, it's little needles, they hurt, it's a little uncomfortable. So that topical anesthetic will do much, much, much better for the patient. And then lastly, after we remove the numbing medication, we clean the area nice and fresh with an alcohol swab. And then we make sure the skin is clean to decrease any risk for any infection. Like I said before, it's one tip per patient, and then they're discarded afterwards. The handheld device and everything that we do is completely, we clean it down per patient, we let it air dry, and then we use that cartridge per patient, and then it's discarded. This here you can see it's one of our patients. We apply this topical lidocaine, or this topical anesthetic, to the skin. This is after she's washed her face. We apply the lidocaine, and we really encourage the patient. We try to leave it on for at least about 30 minutes in general. We play some music, we have you relax, close the light. And once that medication really is absorbed into the skin, the patients will notice that they feel like their skin is a little numb. Then we know that we're ready to go with the procedure. So once we apply it, then afterwards we clean off all of that lidocaine or the numbing medication. We will clean them with an alcohol swab afterwards, make sure the skin is perfectly clean of all the lidocaine, and then we're ready to go. We sometimes leave the lidocaine in the neck area, that way it doesn't wear off as we're moving towards different parts of the skin. You can see that's the handheld device, and that blue light, the clearish area there is where the cartridge is. And then those needles are basically injected into the skin, and then we move. And you could see she's really comfortable. And we try to go over. Most of us have a little pattern that we do depending upon where we go. I usually start with the forehead and I work my way down to the crow's feet, towards the under eyes, the nose, mouth, and then the neck area. This video on the right shows someone who's doing their hands. Same thing, we apply lidocaine to their hand area after we cleaned it first, and then lidocaine, and then we clean the area with some alcohol. And because the tissue is thin, we use obviously a thinner area that we put the needle into. That would be a 0.5 or 1 millimeter depth. And this is great for sun damage. It's great for fine lines as we start to get older. So what to expect?
I just wanted to interrupt. We talk about it, using it for scarring, but I think it's also really great to remember that acne scars is a fantastic use of this procedure. It really is amazing. And we can really tailor with the depth, depending on if we're doing fine lines and wrinkles versus the acne scars. We just have the machine next to us and can change it at any point depending on where we are.
Correct. And then in general, we'll come to how often, but in general, the best results come from 3 treatments ideally, and those treatments are 1 month apart. And so when we start out with the first treatment, we will tailor to what we think you need specifically. And then the next treatment, we may adjust a little bit, and then we may be even to go up the 3rd time. So what to expect? This is obviously pre-treatment. This is a beautiful woman. She came in with some concerns over some spots, some skin damage, some fine lines, although she's beautiful. No one will doubt it. After what to expect, you will get redness. We're taking needles, we're injecting into the skin, and there's an immediate inflammation or a redness that you will notice. After we're all done with the procedure, we basically, in this office, we apply an aloe, and it really soothes the skin and it really decreases the redness immediately. Depending upon how sensitive you are, darker skin colors or lighter skin color patients, some of the lighter skin color patients will notice more redness, and you know your own skin if you tend to get, flushed. It basically goes away within a couple hours. So when you walk out of here, you may be like, oh my goodness, within a couple hours, that redness is gone. You may feel warm, like a little bit of a warmness to the skin that also subsides within a couple of hours. By the next day, from all the patients that we've done this on and know, including myself, you don't really notice much redness. You may notice pinpoint areas where some of the needles have gone in, where you can notice a little red dot, almost like a pinprick. But in general, no bruising. We're really thoughtful about how deep we go, and we avoid certain areas with large vessels, so that shouldn't be an issue at all. These are some great results. So also this patient who's beautiful at baseline, she had some concerns about fine lines. She had some concerns about skin coloring, and she was just looking to improve overall the brightness of her face and the fine lines. So this is just after 1 treatment. And you can really see, especially in the chin area, how there's an improvement in some of those fine lines, corner of the mouth, corner of the eyes, and over on the forehead itself. This is after the 2nd treatment, a significant reduction in obviously those fine lines, overall improvement in the color and brightness. So she was super happy.
And the crow's feet were largely obscured.
I know the big band across eyes makes it hard to see, but in general, we have to, take care of patient identity. But yeah, there was a big improvement of the crow's feet on the corner of the eyes, and I think she was super happy with that. This you could see in the cheek area, those fine lines, and on the corner of the mouth, those little linear lines that you could see. This is just after 1 treatment, going over them, and that's the 2nd treatment, how much of a reduction that patients get with this technology. And this machine is in dermatologist's office, plastic surgeon's office. It's pretty much everywhere. As far as the neck area, so what do patients worry about? Well, they have that crease, that line here. We can really detail and give attention to that fine line or those fine lines for the neck. Same thing, lidocaine goes in the area and we work over that area. And you can see after 2 treatments, without lifting too much, the neck, there's almost huge improvement, complete resolution of those lines in general. This is me, sadly, not the best picture of a before. But my area obviously is someone who works, not a mommy makeover, but a post-mommy makeover. But my big concerns were obviously fine lines in the mouth area, crow's feet, forehead. This was just after one treatment. Huge improvement of the brightness, huge improvement of the lines, crow's feet on the side of the eyes. And you can see right around the mouth area, for me, that just after one treatment, what a big improvement it was. I was super happy with those results. This is the other side of my face, the before and afters. Somehow the other eye looks a little bit better than this side, but in general, improvement of the eyes and corner of the mouth. This is also a mommy, not immediately mommy makeover, but someone who comes to us. Her areas were under the eyes, also chin area, and overall brightening of the skin. This is after just one treatment. And I really do want to emphasize, these are 1 month apart. Ideally, you'd like not to push more than 6 weeks apart. And trying to increase on the intensity from visit to visit, how deep we go and how many times we can go over problem areas. And this is after just 2 treatments. You could see forehead, you could see corner of the mouth, improvement of just skin laxity of the skin. It tightens the skin, it lifts everything up. It's a really wonderful product. This is a side angle from that same patient. The linear lines that you could see that go from the edge of the eye all the way towards the ear itself, those lines are almost eradicated, and that's after one treatment itself. And you could see after 2 treatments, lifting of the cheeks and the cheekbone, underneath the neck, corner of the eye, forehead itself, and just overall brightening of the color of the skin. Another non-immediately mommy, but mommy makeover. This is a patient who also corner of the mouth, deep lines, underneath the eye for some puffiness, corner of the eye for some crow's feet, and then overall color and skin pigmentation. Great color change on the forehead, underneath the eye, decrease in the little lines here, improvement in the overall mouth area, and also in the neck. Those fine lines in the neck area started to lift. This is just after 1 treatment. I think the big thing for me when you look at the side of the face is also that little scarring and those little pocketings of the chin here. This is after just 1 treatment and a very big improvement, both in brightness and color. Hands, this really can be done anywhere. Once again, we talk about women and with just age in general and the laxity and the collagen. You're taking these needles and you're puncturing the skin and you're building up that collagen from the base down. These are hands that are quite beautiful before. And then the afterwards is pretty incredible. This is after just 1 treatment, fewer fine lines, fewer improvement in the color. And then obviously this is after 2 treatments and a really significant improvement. Much more youthful hands. This is Dr. Gottlieb doing it on a scar. And also just, I think this was actually overall just the leg. We're looking at creping of the skin and tightening of the skin. We put some lidocaine on the skin itself. These treatments can be really done anywhere. So we look at stretch marks for women after having children or weight loss. These can be tailored towards stretch marks for women who have lost weight and even men. These scar that you can see here, this is before and after just 1 treatment. You can see the depth is much more shallow. The overall color and the pigmentation of the scar is a lot better, and those fine lines. And this is just 1 treatment. Ideally, 3 treatments is what we're looking for.
And sometimes with the scarring, it may take a few extra treatment or 2. Same thing with the acne scars, to just smooth out the area a little bit more. Routinely, just for the fine lines and wrinkles, we recommend 3 treatments.
So when we look at skin revitalization and the technology and why people do microneedling, there are microneedlings that you could do with handhelds that don't have this bipolar technology. But once again, when you look at the bipolar technology, you could see here in her chin area how it lifted. You're tightening the skin in the neck area, overall tightening of the neck. And then in this deep area here, those fine lines in the chin and the mouth area, a much more blunting and shallowing out of that deep line area. I think this just speaks for itself. I probably don't have to say very much, but the pictures are remarkable. This is two treatments. The picture on the left, when we look at it, we're looking at what we call creping of the skin. Either this can happen with age, some weight loss, but we want to tighten that skin and build up the collagen. And what we do is we basically apply a lidocaine ointment to that thigh area above the knee. And then we literally just take our handhelds and we work our way down. And you can see from 1 treatment to 2 treatments, and then that third picture right there is after 2, how much of an improvement of the creping of the skin we could see and tightening of the skin. They look like 2 different legs. This is just some testimonials of why patients are happy. People are skeptical, right? They don't know about this cosmetic stuff and they think it may not work. We know that microneedling works. This technology is wonderful for many of the reasons that we said. And obviously you can just see from the pictures, they speak for themselves.
I think just one more thing about the different types, the secret RF versus the truSculpt ID. Sometimes people come in and they think they would like to do the fat reduction with the truSculpt ID. And when we examine them, we realize that they're more complaining of the laxity in the skin, and they don't have the fat that needs to be reduced. And we will kind of, because we are the ones examining you, we will cater to what we think is best. So I think that leg, for example, is a great example where the patient, I think, came in for the truSculpt ID, and on exam, it was more the laxity, and we switched it over to the secret RF. And we've had that happen a couple of times.
At this point, feel free to text in the chat button any questions you may have. And we're available to answer any questions, to clarify anything that was discussed. As one of the providers, I also did a truSculpt, and my belt is a notch tighter and my weight has stayed exactly the same. So it's definitely has an aesthetic as well as a personally observable change in your body habitus and the way you carry.
I think we have
Okay.
a couple of questions.
Yeah. Are there any side effects is one question. I think we addressed some of those. Clearly, the truSculpt will give you some warmth and sometimes some transient redness. And similar to the secret, you'll absolutely positively get some redness, but 24 hours later, there's no signs of either of those. The next question is there an effect on breastfeeding? And clearly we've done this with lactating patients in the past, and there's absolutely no reason to avoid this on breastfeeding patients. We don't perform these procedures on pregnant patients.
I do think, though, there was some conversation to clarify, and we can check, but for newly onset, immediately postpartum breastfeeding moms, and typically depending upon the procedure that you're doing, the company suggests potentially anywhere between 3 to 6 months of holding off before doing the truSculpt, especially in the belly area. And I think if you're immediately breastfeeding, they do suggest not immediately doing the bipolar technology immediately after that, or the monopolar. But if your breast milk is established and it's been for several months, there should be no reason not to be able to do the procedures.
2 people asked the same question, and that's, do you suggest having all your kids before doing this? Clearly, that's a role for things like abdominoplasty and vaginal surgeries that can be affected by a subsequent pregnancy, but there's absolutely no reason to wait until you're done with all your kids. This is a permanent reduction in fat. It's not going to impact negatively on a future pregnancy, and there's no reason to wait until you're done having all your kids.
No, and I think the nice part about this, which made it so easy for us to want to incorporate into the office, is you're talking about really no downtime, no surgical intervention. You can really go about your day. And obviously, with the exception of spending money, which, you know, you're obviously making an investment in how you feel and how you look. If you know you're going to have a baby again 6 months later, maybe you may not want to decide to necessarily jump into do the fat reduction if you're going to have a baby a month later, because you're going to be gaining that weight back. But this has no long-term impact. So you could do as much or as little as you want to do. And as far as the face goes, you're only going to improve it once you do those 3 treatments. And once again, depending upon what it's for, if it's for face, typically 3. If it's for scars, like deep acne scars or C-section scars or scars elsewhere, it may take more than 3 procedures to do. But then to maintain it, you would want to necessarily do one several months. You know, you could do them up to a year afterwards to try to maintain the collagen buildup that's underneath the skin.
Which is a segue into one of the other questions, which is how many weeks are between images. So as Dr. Lamb just mentioned, the secret, whether it's the face or the scars, can be done as frequent as every 4, 5, or 6 weeks. But the truSculpt, to really have the optimal effect, 12 weeks is ideal. Another question, very interested in both, but not sure where to start. Could you help determine goals through a consultation? Absolutely. We do aesthetic consultations on a regular basis. You don't have to commit to a procedure. Give Carnegie Women's Health a call. We're more than happy to set up a half an hour consultation with any one of the 3 of us.
We can also do some of these consultations virtually if that's
More convenient, right?
Yeah.
There's a question comparing this to other procedures such as Sculpture, which I'm not too sure about, and CoolSculpt, which I have heard some negative things about. I do know that CoolSculpt can often cause modeling and that it's not as nearly as smooth a recovery as the truSculpt. We've actually done a couple of truSculpts on patients that have had CoolSculpt and it helped rectify some of the modeling.
You know, and I didn't have the, you know, the competitor's procedure. I haven't really seen it in person, although I'm very familiar with it. And the technology being hot and cold, when we did some research into it, we felt that the heating up of the fat tissue was a superior way of obviously doing this fat ablation. But the other technology that a question was asked about, which was regarding to freezing, there's just one size brick essentially that is used on a patient. And that fat gets sucked into that technology itself, and they freeze that tissue. There is a downtime. You're not immediately able to work out and exercise. The flexibility of the technology, meaning that if you come to us and we look at in terms of paddles, like how many we're going to use, we can really move those paddles around to those problem areas. With the other technology, which is cold, it's one size and that's all. You can't necessarily manipulate it that well. So if you want to try to get the flanks in the front and wrap it around, we can do it a little bit better. I'm going to clarify in the fact that for the truSculpt, which I think Aaron talked about, the procedure itself takes 15 minutes. Now, if you decide you want to do the front and the back, like if you wanted to do your flanks and you wanted to do underneath your belly button, those are 2 separate 15-minute sessions. They can't be done at the same time. Meaning you could do them back to back on the same day for 30 minutes, but we have to do the 15 minutes and then we turn you back over, we re-examine, and then we reapply those paddles. So it's in 15-minute sessions. We can do anything on one side of the body with up to 6 paddles at the same time.
Right. And one more thing regarding the difference between the truSculpt ID, which is using heat, and the CoolSculpt, is that the puckering or modeling that you're going to get with the CoolSculpt, with the heat, you are going to get, and I believe Dr. Lamb said this before, that heat is going to emanate in between the pads or go laterally or above and below the area. So it will cause a smoothness. So you won't have any of that puckering.
There was a question, how long after a delivery can you do this? We've been recommending 3 months post-vaginal or post-cesarean prior to either the truSculpt or the Secret.
I also think it's really important to feel where you are. So we may say 3 to 6 months, but if you haven't, you know, it's not the opportune time to come in and say, okay, now I'm going to start getting back to where I was. I think it's important to give yourself the time and feel good and kind to yourself and say, you know, I'm working on getting back to where I was before. And once you feel like you are around that area, then that's the time to come in and really have one of these procedures done, just for the extra little bit of help that I can give you. It's not, I think we all said before, this is not the procedure where you're going to lose 10 pounds from. This is the procedure to get those little trouble spots, and you'll feel great about it, but you got to be at that area, and we can help you with that. That's not a problem. And remember, CWH and MFM also has other services like nutrition consults and
Yep.
things. If we can help you with that, that would be another option.
Well, we look forward to hearing from all of you. I'm very glad you participated, and hopefully we answered and addressed the issues that you bring to our webinar. Please take advantage of all our services: women's health, bioidentical hormone treatment, cancer genetic screening, aesthetics, as well as very pleasant physicians.
Why, thank you, Michael. Thank you, everybody.
Thank you.
Have a good one.